Welcome to the 2017 CIRPD WWDPI AGM meeting, as well as an integrated approach to knowledge transfer and communication for occupational and health and safety webinar. We're glad you're here. My name is Angie Hunt, Project Manager with the Work Wellness and Disability Prevention Institute, formerly known as the Canadian Institute for the Relief from Pain and Disability, and I'll be moderating the webinar today. This webinar is made possible through the support of the Community Gaming Grant Program to the BC government, as well as donations and memberships. While we're waiting for others to join us, I'll go over a few technical points for the webinar. You should be able to hear the presentation through your computer speakers or through the conference call line if you dialed in. Please use the question box to submit any issues you may be experiencing and to ask any questions you have related to the presentation. We'll collect questions submitted throughout the presentation and follow the presentation with a Q&A based on the questions submitted. Following the webinar, any questions not answered in the allotted time will be answered and distributed after the event. The presentation will be recorded and posted for free on our website within a week, along with the slides. You'll be emailed the direct links for all these items when they are available. As I mentioned, my name is Angie, and I'll be moderating the webinar and Q&A session. Our presenters today are Dr. Dwayne Van Erd and Dr. Ron Sanders. Dr. Dwayne Van Erd is a scientist at the Institute for Work and Health, where he has been a researcher since 1997. He is an MSc and BSc in Kinesiology from the University of Waterloo, an MSc in Health Research Methodology from McMaster University, and a PhD in Work and Health from the Faculty of Applied Health Sciences at the University of Waterloo. Dr. Van Erd focuses on research on the prevention of work-related musculoskeletal disorders and the implementation of prevention initiatives. His research projects have included evaluations of participatory ergonomics and training interventions, as well as systematic reviews of the prevention literature. Dr. Van Erd also practices and researches integrated knowledge transfer and exchange. Dr. Ron Sanders is a senior scientist and director of knowledge transfer and exchange at the Institute for Work and Health. He is also an associate professor in the School of Public Policy and Governance at the University of Toronto. Ron has a PhD in economics from Harvard University. Ron joined IWH in November 2008 from the Canadian Policy Research Networks, where he was Vice President of Research. Prior to his time at CPRN, Ron spent 17 years in the Ontario Public Service, most notably as the Assistant Deputy Minister of Policy, Communications and Labour Management Service in the Ontario Ministry of Labour. Ron has been leading IWH's efforts to integrate KTE into research processes throughout the dialogue with key stakeholders on research priorities, on the framing of research questions, and on the communication of research findings. And now I'll hand it over to Dwayne.
Thank you. So I'll start off by saying that this presentation is not a how-to. It's not a should. This is not a you should do, but it is more about what we do, and hope that that's of interest and maybe something that could be applied in other areas as well. And the other thing I'll mention as a start off is that this is really an approach. It's not a model. There's lots of theoretical frameworks, conceptual frameworks, models out there. This is a practical approach, so we'll be speaking to it with that lens. So with that, I'll launch in. I'll give a little bit of an overview of the presentation. I'll talk a little bit about who we are at the Institute for Work and Health, a little short intro, and then spend most of my time talking about integrated knowledge transfer and exchange at the Institute for Work and Health, with a kind of equal split with engaging stakeholders or knowledge users and communications. The other interesting thing about the integrated knowledge transfer and exchange here is that we also integrate communications with our knowledge transfer and exchange. So we'll talk a little bit about that. So after about 20 minutes, I'll turn it over to Ron, who will talk about measuring reach and impact. So I think that'll cover us for the length of time for this webinar. So the Institute for Work and Health is a not-for-profit research organization based in Toronto, in Canada. We conduct and share research to protect and improve the health of working people. So our research is carried out in two main areas, basically. Looking at prevention or preventing work-related illnesses and injuries, or improving the health and recovery of those who are already injured, so of injured workers. Within that frame, we will talk about knowledge transfer and exchange. So importantly, we think about the users of research related to work injuries or work disability. And we think about as many audiences as we can. So we include in our thinking about the knowledge users a broad group of people, health and safety practitioners such as ergonomists or consultants, whether they work within a company or work outside of a particular company. Any workplace party, managers, worker representatives, workers and injured worker associations, employers and employer associations, union and union representatives, workers' compensation boards, government policymakers, and clinical practitioners, those that may be addressing work-related injuries, physiotherapists, kinesiologists, chiropractors, etc. And we also think about disability management professionals, those people who are helping to get people back to work. So you can see from a knowledge transfer point of view, we are looking at a very broad audience at the Institute for Work and Health. So our approach has been to be integrating the knowledge transfer and exchange. So with that in mind, IWH has a team that's dedicated to supporting the integration of knowledge transfer and exchange in our research work. So our goal with knowledge transfer and exchange is to make relevant research evidence accessible through interactive engagement with the audiences that can help to have an impact on work and health. So they may help to inform practice, planning, or policymakers. This approach that we're talking about today has been developed over at least 20 years, and we think it's still developing. So we're still learning, applying what we read or hear about in terms of knowledge transfer and exchange, and adapt on the fly, as it were. And just a little bit more about the Institute to give a sense of the integration of communications and stakeholder engagement. This is a representation of our organizational chart. So we have within the group of people that do knowledge transfer and exchange at IWH, an overlapping group of people that work with stakeholder engagement and communications, all under the director, Ron, who can speak to this more if I've messed it up. So more here to say that we truly do feel like we are integrating communications and as well as stakeholder engagement as a core aspect of our knowledge transfer and exchange approach. So we are integrated both organizationally and in practice, I guess, is the shorter way to say that. So for the more detailed part, so how do we achieve our goal then of integrating knowledge transfer and exchange? Well, and I'll talk about each of these in a little bit more detail in a moment. We build and maintain stakeholder networks and relationships. We build stakeholder or knowledge user engagement into the research process whenever possible. We work to enhance the capacity of our audiences to better understand and make use of evidence and research in general. And we also develop tools and communication techniques that facilitate the dissemination and application of the research evidence. And so there, it's not just getting research out to people, but helping them to use it, as you'll see in a moment. So taken together, these four areas, activities, strategies, come together to what we consider to be integrated knowledge transfer and exchange. So there's overlap. There's a bit of symbiosis of all of these things that work together that allow us then to think about this as an integrated approach, reaching audiences, building capacity, and sharing research that can be used in work and health. And again, I'll just mention the integration of communication. You'll find that I say that a fair bit because it's something that we think is an important part of our approach. So just to outline a little bit more these 4 areas, we maintain networks and relationships with knowledge users. And I'll mention here as well, knowledge users, stakeholders, and audience are terms that are pretty much interchangeable. So if you hear me say those words, we think of them as the same thing, basically. We hold regular meetings with a broad representation of health and safety system partners. We are focused in the province of Ontario, but often reach out to partners outside of the province as well. We talk with policy officials and influential practitioners, those people who are involved in the day-to-day aspect of work and health in workplaces. We've heard from our stakeholders that face-to-face meetings are important. So many of these meetings that I'm speaking about happen in a face-to-face or sometimes in a conference call setting, but it's a personal meeting, basically. We establish these networks for that purpose, to have these regular meetings and to be able to share research with known entities. People will recognize who we are after we've spoken a few times, and that helps us to maintain the research connection and the dissemination connection, but also the engagement connection with these individuals. We like to engage directly with these people so that our research is timely and practical. We also work to engage knowledge users or stakeholders in the research process. We tend to have regular consultations on emerging issues. Again, this idea of timeliness. What is it that needs to be addressed, or what are the needs of the knowledge users? The more that we hear about that, the more that we can tailor some research towards those areas. We speak with our knowledge users before we get grants going, so that we can get this information and make the research we do more applicable, more practical. We ask stakeholders to participate either as in advisory committees for our research to keep us on the path of practicality, or as research team members if the time and skills allow for that. And then we also engage when research is completed and follow up with these groups to find out how we did, or how research is used. Are they using the research that we are sharing with our audience? We communicate findings broadly. We look to reach beyond the networks that we establish, or the people that already know about us, and go much more broadly. We produce and disseminate evidence-based tools and guidelines, as well as newsletters. We provide research summaries, or summaries of different types of research, such as systematic reviews, and provide briefings on policy issues. So these dissemination or communication methods can go out via our website, through social media, or email, or e-alerts. And we also will communicate with those people that we meet with in person and let them know about these things, especially if there's something that we've heard is important. So when we're speaking with them, we let them know there's something coming, or something that's just been released. And broadly, we work to build the capacity to use research among our stakeholders and our knowledge users. So we have a popular column on our website, which is what researchers mean by. That is one way to build capacity, better understand how to use research, better understand how research is conducted. And we conduct regular workshops on things like systematic review or other research methods like measurement.
No, just leave it here.
Where we engage with stakeholders and basically share how to or how to interpret the results of these particular types of research or systematic reviews. And every opportunity that we get a chance to meet with knowledge users, we take that opportunity to increase capacity, to think about how they could learn a little bit more about what research is, or how they can use it. In particular, how to use the research is what we're interested in. We take the time to mention our methods when we engage with our knowledge users. And perhaps more anecdotally, we've gotten to the point where some people that we meet with regularly are quite quick to say, okay, we've heard you talk about methods before. We trust that you're doing good methods. Get to the results. So building relationships allows us to do that, allows us to take those kinds of shortcuts, if you will, and not belabor some of the methodological things that, let's face it, us researchers find interesting, but not maybe everybody does. So we have that kind of relationship with our knowledge users that allows us to get to the quick. What can I use in my my day-to-day work in solving problems that are related to work and health? So just to think about it, as I mentioned, we talk about stakeholder engagement, but there's quite a broad spectrum for stakeholder engagement. We might focus only on dissemination, that is, getting a message out broadly to an audience or audiences that can use it. So we've done the research, we're just end of grant, if you will, getting this message out. This works best. But we favor looking at engaging with research. So we may talk to our network members more specifically. They talk to us about what's relevant and maybe give us advice on new projects to help them be more practical for their needs. This can help us guide our research and also helps us to think about the messages that we might create from the completed research. We also talk or ask many stakeholders to be on advisory committees for some of our research projects. That allows people to give us direct communication, direct advice about a project at key stages. Again, our hope is that that will help keep things practical and focused on solving the problems that are out there, so that we don't get all researchy and think about the methods only. We also have an opportunity to work with research participants as collaborators, and then they basically help with all phases of the research, if you will. They might help with determining what intervention we should do the research about, or how to implement those interventions. That's an area of research that I'm particularly interested in. They maybe also help us with data collection or providing us with feedback based on the findings that we're going as we go through the research project. And when it's feasible and practical to do so, we invite stakeholders to be co-investigators. So they're a full member of the research team collaborating with the research, all the way from informing the research question, planning and executing the project, the research project in its entirety. And then again, coming back to help us make sense of the outcomes and what messages are most reasonable to come from those outcomes of the research. Then as a co-investigator, they're involved in the writing. and the presentations that might be given based on the research findings. So as you can see, that there's an increase in the amount of engagement in this spectrum that we've described. Not all research projects work at all levels, so we use whatever engagement is practical and feasible, but we think that the more engagement that people have, that audiences and stakeholders have, the more uptake, use, and impact that the research findings will have. Yeah.
One thing, Ron, here that I was just going to add on that is there, and that's one area where there's some research evidence to support that, right? That there reviews by Mitten and others, a systematic review a few years ago by Oliver and colleagues that actually have evidence that engaging stakeholders, knowledge users in the research process and building ongoing relationships with them does lead to better uptake. Their work was really focused on policy users in particular, but in that domain, certainly there's evidence that more engagement tends to be associated with more uptake.
Right. Thanks. And so as we think about that and work towards having stakeholders be part of our research teams, we think about how to integrate knowledge transfer into our research process. And so this is a little bit repetitive from what you've heard me say before, but we talk with stakeholders to help us identify emerging issues, so that may help create the research questions that are most pressing. We engage then with developing research plans, engage with supporting the grant applications. This is the we need a letter of support question that comes out. But with a good with a good engagement with our audiences, that's an easy ask for us. They know us and have worked on other projects with us very often. They may be part of our research team and fine-tune the research strategy. Or we may come to them after research is done and review the draft findings. Let's think about what this means and how we might best convey the messages to the audiences that are most interested and can use the research results. And of course, whenever we can engage with stakeholders to disseminate our findings, we think both from the point of view of uptake, but also to help reach broader audiences, we engage with our networks and ask them to help us disseminate the findings of research that can be helpful. And so it brings together this idea of the amount of time and effort that we spend building the networks, maintaining the networks, which is maintaining relationships with our stakeholders, is important because that is how we engage people within the research process. And by engaging our stakeholders within the research process, we hope to build capacity so that they're not only aware of the research, but are able to use research, both the research that we produce here and that our stakeholders are most engaged in, but also research that they come across when they're looking for other research in the literature. They may be able to use it or implement that research better after being engaged in this full research process. So I think with that, I will turn it over, unless Ron has anything to add to this, and we'll switch gears and talk a little bit about measuring research and impact.
Okay, so I'm going to talk about the approach we've taken at the Institute for Work and Health to measuring impact, which is, of course, a big challenge for research organizations. And we make a distinction, perhaps a fairly obvious one, between measuring reach and measuring impact. It's much easier to quantify reach than it is to quantify impact. So we do measure reach, and our board of directors likes to see numbers from time to time. And so, you can do counts of these sorts of things. So we do track numbers of people who receive and view our products, right? So it's fairly great to measure web visitors, to measure downloads of particular products, to measure the numbers of people who are getting our newsletters, and we, it's an effort that we're making constantly to grow, that list. We do use social media, Twitter and LinkedIn in particular, so those are things. The number of Twitter followers, the number of retweets of our tweets, of course, all of those things. We're now looking at altmetrics of some of our research papers that combine some of these forms. So those are things that you can quantify. But of course, that doesn't tell you whether people are actually using what you've produced and how they're using it. So the things that are easy to quantify are the things that are perhaps less interesting in terms of really having an impact, right? And so in terms of measuring impact, mainly what we do is tell stories. Mainly what we do there is not actually try to quantitatively measure what is our share of some quantitative outcome that's related somehow to research that we did. For the most part, what we try to do is identify people organizations and influential people within them who have used our work to change policy or practice. And then we'll talk to them about how did you use our work? And what have you done with it? And what sorts of results are you seeing? And the ways in which we identify candidates for this kind of storytelling, sometimes it's because people email us with testimonial. We saw this piece and it's great and we're using it in this way, a kind of testimonial. And sometimes if it looks meaty enough, we'll follow up with them and see if there's a kind of rich enough story of use there that's worth documenting as an impact case study. We've bolded on this slide advisory committees and research collaborations because it relates to the whole idea of integrated knowledge transfer and exchange, right? The fact that in most of our projects, we do have knowledge users or potential knowledge users involved in the research process makes it easier to then work with them later on to talk about how they're then going to take up the research that they've been a part of, right? And so that's become an important way in which we can track subsequent use is by following up with our collaborators who were knowledge users or stakeholders or knowledge users. We also, of course, monitor reports of some of the key bodies that we work with, particularly policy organizations. WSIB there is the Workplace Safety and Insurance Board, or the body, the agency that's responsible for workers' compensation in Ontario. MOL refers to the Ontario Ministry of Labour. So we will monitor their reports, their bulletins, to see whether they are using our work. And sometimes, we will find something they haven't actively communicated to us about that they are actually citing our work in some of the work that they're doing. So there's a variety of ways in which we try to identify examples of sort of substantive use of our work to influence policy or practice. But the fact that in most of our projects we're doing integrated KT where we've got knowledge users part of the research process does help in terms of doing that. When we tell these stories, we've divided them up into three types of impact shown on this slide, although I would say the vast bulk of them are in the second type. The first type is really just examples. It's more like reach than impact in a way, but when we do identify these as case studies, when there is use of where our work is being referred to by external stakeholders who are influential and who reach a wide audience. So for example, there was a case several years ago of the German Social Accident Insurance Agency, known sometimes by its German acronym DGUV, that launched a social marketing campaign on the prevention of musculoskeletal disorders. And they indicated that in developing that campaign, they drew on our systematic reviews on the prevention of musculoskeletal disorders. So they were citing our work as one of the foundations for the development of their social marketing campaign. So we knew that our work was being looked at and used, although we didn't really, in that case, we didn't really know how ultimately it was being used by workplaces. So we documented that as a type 1 case study where there's evidence of the diffusion of our research. Most of our storytelling, though, is around case studies of organizations who have used our research to inform their decision making around policy making. So it could be around legislation or regulation or government policies or programs, or it could be around workplace practices, clinical practices. It could be around the training programs offered by health and safety associations to their clients. So where we've seen that our work is being taken up to inform policy or practice in any of those ways, then, as I said, we will talk to key people in those organizations and tell the story of how our work is being used usually without trying to quantify the extent to which our work has had an impact, but just tell the story. There is a type 3 that is difficult to get to, which is evidence of societal impact. So not just that the research is being used to change policy or practice, but that those changes in policy or practice have led to changes in outcomes for workers, right? They've led to better worker health and safety, or they've led to workers coming back to work more quickly in a sustainable way. Those impacts, for one thing, often take a long time to develop, well after a research project has been completed. They're typically part of a chain of causation where there's multiple factors involved. So it's difficult to attribute when you're looking at societal impact. But we have had examples of where policymakers have identified changes in one or more of these outcomes and have said to us that your work was particularly influential in the policy change that led to these outcomes, and where they have quantified changes in outcomes such as improvements in labor market opportunities for workers who have been injured and are unable to return to their previous employer. They used our research to help inform a redesign of the whole process of helping those workers be reemployed. Where that was quantified, then we will report on how our client quantified those outcomes, but we won't attempt to attribute, a percentage that we're responsible for. So again, we're not really quantifying our impact, but we will report ways in which our clients have quantified outcomes that they have measured and where they've cited our work as being influential in achieving that outcome. So this is just a graphical representation of the same thing, but it at the bottom, it has explicit what I've just what I've just talked about, which is it's harder to do as you go across from type 1 to type 3. Most of what we put our effort into is this type 2 storytelling, where we're identifying that the work has been used to change policy or practice. We're not yet at the point where we have been able to track influences on final outcomes, but we'll tell the story of how at least policy and practice is being changed. And there's a number of, we started doing this about 10 years ago, and we've documented now 32 of these impact case studies on our website. We've done sort of summary versions of the case study. So if you go to the IWH website under knowledge transfer, you will see a listing with about 1 to 2 pages of summary text about these impacts that we've had in 32 cases that we've documented. And they range, from work that we've done around the prevention of musculoskeletal disorders through some of our more recent work to develop ways of measuring, developing leading indicator and testing the measurement properties of different leading indicators of outcomes regarding worker health and safety or work disability, particularly in this case of work injury and illness, leading indicators of outcomes around improving work injury and illness outcomes for workers. So we've done a fair bit of work on that recently, and we've documented some of the ways in which that work and those measures are being used by others. We have developed in the last 2 or 3 years a conceptual framework looking at the vulnerability, or in a sense, the risk of work injury at the lens of the individual worker. What are the factors that create a higher risk of work injury for an individual worker, most of which are factors related to the workplace, but looking at it through the lens of the risk of individual workers of work injury or illness. So we've developed that conceptual framework, and we have fielded a survey based on that conceptual framework several times now to workers in Ontario and British Columbia, as it happens, and reported on the results of that survey. And we've kind of validated the framework by showing that people who are more vulnerable according to our framework also report higher injury rates in the surveys that we've done. So that's another example of work that we've done. We've done quite a lot of work around accommodation and return to work practices, including the one that I mentioned just a minute or two ago, where the Workplace Safety and Insurance Board in Ontario kind of revamped its program around reintegrating injured workers who are unable to return to work with their previous employer. They revamped their program on facilitating the reemployment of those workers, in part based on findings of research by the Institute for Work and Health. And so we told the story of how they used our work and the sort of changes they identified after they had done that revamp of their work reintegration program. And the last example I'm going to mention is one where our research has influenced some activities of people in the prevention system in Ontario in particular, but it's also changed the discourse in a way, because if you go back 10 years, perhaps a bit less than 10 years, there was a lot of activity, social marketing programs around the risks facing young workers. The notion that people who are sort of late teens, early 20s have higher injury rates, and there was a lot of talk from the Ministry of Labor, from health and safety associations, developing training programs that were geared to reducing the risk of injury for young workers. But colleagues of ours did research and sort of explored what were the factors that were really driving the observed higher injury rates among young workers, and found that it wasn't their age that was driving these findings. It was the fact, well, there were a number of factors, including that they tend to be disproportionately in more risky occupations. But one key factor that they found was being new to the job, that people who were in the first month of their job were much more likely to be injured at work than people who had been on the job for a year or more, 3 or 4 times more likely to be injured on the job in the first month on the job. And they repeated this research so that they found it to be a kind of stable finding over time. And that this was true not just for young workers, but for workers aged 45. If they were in their first month of their current job, they were much more likely to be injured than other workers were. In fact, the differential was no different for those workers and young workers. It's just that young workers are more likely to be new. So you might find young workers more likely to be injured, but not because they're young. And so that research led to a change in the social marketing programs in Ontario. So there's from a young worker campaign to a new and young worker campaign. There's actually, I think, in British Columbia, there was a switch also to a focus on new workers, and some of the work that WorkSafe BC has done, and you see it in some of the programming in Ontario, and so it's now become part of the discourse that people refer to not just young workers but new and young workers, and will often refer to the finding that people in the first month on the job are 3 times more likely to be injured than workers who have a year's experience or more, without even citing the source of the finding. It's sort of become something that's understood in the system. So that was a case that we spent a fair bit of time documenting, and this is just some taken from some captures from some websites that show this shift from young worker to new and young, or just new worker orientation guide in the case of health and safety associations in Ontario. So that's just to give you a bit of a flavor of the way in which we've approached identifying impact and telling stories of impact. So before we open it up for questions, there's our standard acknowledgements that we operate with the support of the province of Ontario, but they don't necessarily agree with everything we say. And we've brought you back to that image of the 4 pillars of our approach to integrated knowledge transfer and exchange. And I'm not sure there's anything beyond. Oh yes, well, there is our slide. Gee, I shouldn't, as director of KT, I shouldn't forget that slide, which is, if you're not already getting our stuff, these are various ways in which you can. In particular, I would recommend that if you're not getting our e-alerts, then it would be great if you would sign up to do that. There's the web link there, but you can find how to sign up on the front page of our website. And I think that pretty much does it for us. Yes, maybe I'll come back to, well, we'll just leave that. Okay, so I guess we're at the point where we have a bit of time to take questions.
Thanks to our audience. If you have any questions at this time, please enter them into the question and answer panel on the GoToWebinar box.
Yes, hi Ron and Dwayne. It's Mark White. I'm the CEO of Work Wellness and Disability Prevention Institute. And I wanted to thank you for your presentation. It's fabulous and very timely for us as we also go through our own rebranding. And one of the things that we're going to do this year, finally, is we're going to be launching the Health and Work Productivity Portal project. And one of those things is to look at ways of building sort of communities of practice with our stakeholders, so that there can be more engagement across stakeholders. So, for instance, we have a focus on reaching out to human resource professionals as one of our target groups, and I'm just wondering, have you had some thinking about how, rather than the focus on just looking at use, but actually looking at methods for having some cross fertilization and discussion, so that those that are involved in making changes can work with others that are involved with making changes?
Yeah, great question. So we do have an interest in promoting dialogue across our stakeholder groups. One of the ways in which we try to facilitate that through an electronic vehicle is actually through LinkedIn groups with our So for a number of our stakeholder networks, we've established LinkedIn groups for that network. But frankly, we have not found a lot of engagement through that vehicle. And what we found a lot, where we have been more successful is actually in the face-to-face stuff. So in our face-to-face meetings with key stakeholders, we have tried more and more in recent years to bring different stakeholder groups together face-to-face to try to promote that sort of cross-connection between among different stakeholder perspectives.
Yeah, for example, I may have mentioned, I think earlier on, that we looked at one of our audiences are the clinical practitioners, if you will. And some ways that we engage with those are called educationally influential groups, where we have groups of people that are nominated as educationally influential, and then they become part of a network that we work with consistently here at IWH. And we were communicating with these groups rather independently or individually for a short while, but we now have arranged a summit where they all come together, and they liked it so much that we're going to continue to communicate with them in our face-to-face communications, so that these various groups with a common goal come together and talk with us about the research and work together to think about how to reduce the disability of work injury. So we have been thinking about that, I guess, is the shorter answer to your question.
Thank you.
Another question that came in is, what are some examples of safety and health partners that you have worked with?
Well, I'll start. Dwayne's done a lot of on-the-ground participation in that, so he should definitely jump in. We do, I'd say we do a lot of collaboration. Well, almost all of the stakeholder groups I mentioned, actually, we collaborate with more or less, like so that not on every project, but we will recruit them to be part of stakeholder advisory committees across the different kinds of knowledge user communities we have, workplace parties, health and safety associations, policymakers. I would say, in terms of, if you think of that spectrum slide where you talk about more intense forms of engagement, where people are actually collaborators or even co-investigators or even co-principal investigators, I would say that's happened more with the our Health and Safety Association partners in Ontario, where they've really, kind of built the capacity to work with us as research partners. So we've done a lot of work. In Ontario, there are health and safety associations organized by sector that provide training and consultation services to workplaces, and we partner with them quite a lot in identifying research opportunities and in collaborating with them on research projects.
And for me, one of my areas of interest is preventing musculoskeletal disorders. So I've had the opportunity to work very closely with ergonomists in the province, either as independent consultants or as part of the Health and Safety Committee. In one instance, we were able to complete a systematic review on the effectiveness of participatory approaches with one of the stakeholders, who's an ergonomist from Ontario, as a full member of the team. It was a lot of fun to present the findings with that individual as well.
Okay. I think that is all the questions for now. Dr. Van Erd, Dr. Sanders, is there something that you'd like to add following your presentation?
No, I don't think so.
No, I don't think so.
Thank you for hosting us.
Yeah.
Absolutely, and thank you so much for your presentation.